An inspector shortage leaving dozens of Alabama nursing homes unchecked. Thanks for joining us at 6:30. I'm Guy Rawlings.
And I'm Sherry Falk. The state has the second highest inspector vacancy in the country. WVTM 13's John Pappy is here with tonight's Special Investigates report. John, how often should nursing homes be inspected?
Well, Sherry, federal law requires that all nursing homes undergo a comprehensive inspection every year or so. But thanks to the pandemic and other factors, about half of Alabama's facilities are behind schedule, leaving nursing home safety reputations and residents' confidence in their care in limbo. The pandemic originally put routine nursing home inspections on hold across the country. When they resumed, states like Alabama faced a major backlog. Now, staffing challenges are keeping inspectors from catching up. According to this U.S. Senate report, Alabama's nursing home surveyor vacancy was at 80%, second only to Kentucky.
I will offer a sincere apology if anyone feels that, we have let them down.
Dr. Amber Clark Brown is the medical officer for the Alabama Department of Public Health, which oversees the state's nursing home inspection program. She claims retirements and the financial pull of the private sector have kept their numbers low.
There is no way our salary wages can compete to those of traveling nurses or even, working in hospitals or other settings.
So what does that mean for your loved one relying on quality nursing home care? The state's Nursing Home Association Director John Matson says facilities need that layer of accountability which inspections bring.
It's good for the nursing home because we can improve. And of course, it's good for the state of Alabama because they're able to ensure that residents are receiving good nursing home care.
Unfortunately, the current surveyor shortage is leaving many nursing homes behind. We reviewed the latest federal inspection data and found nearly a third of Alabama facilities had not undergone their routine annual checkup since before the pandemic. 15% had not received one in 4+ years. Matson says that is a major public perception problem.
So the nursing home may have come in, done a lot of things, changed things, really improved the care, but the public has no way of knowing that because those results have not yet been posted because the nursing home has not been inspected recently.
Dr. Clark Brown says they are chipping away at the inspector vacancy gap. So far this year, she claims they've trimmed it from 80 to under 70%.
What would you say to the residents of those facilities that the ADPH is doing what it can to ensure they are being properly cared for?
I'll tell you that we are doing everything that we can, and we are fully aware of the situations. We don't take any of this lightly.
She pledges their growing team is prioritizing serious resident complaints whenever they pop up. Well, now, Dr. Clark Brown says they do not have enough money to hire all the surveyors that would fill their ranks. They only have enough funds to hire about a third of the inspectors they need. Well, if you want to know when your loved one's nursing home was actually last given the once-over, we've created an entire database for you on our website. Live in Birmingham, John Papke, WVTM 13 investigates.